Hi, I'm Dr. Molly with Your Goals Physical Therapy. If sciatica is taking the joy out of your weekend cycling, this is the video for you. So I met Aaron about, 6-8 months ago. Anyway, something to that effect. And he had been suffering from sciatic pain for months. He had pain if he sat for too long. He was getting residual pain even if he took too long of a walk. And it was going from his butt all the way down his leg at some points. And so he had been dealing with that for a long time. He was like, it was relatively minor. And, I could get into positions and it just went away. It was fine. And it didn't interrupt me going for bike rides on the weekend, which was his main thing. That's his main source of entertainment and how he hung out with friends. See, Aaron would get on his bike and ride 30 or so miles. Their goal would be to hit some bar that had a patio so they could hang out, drink, have lunch, and then they would ride back. And that was basically their entire Saturday, him and his friends. And so that was something that he habitually did, and he really, really enjoyed it. So his back pain bothering him at work didn't really affect his bike riding, and so he sort of ignored it and put it on the back burner, assumed it would get better eventually, or just was ignoring it. It wasn't until the pain that was going down his leg started affecting lots of things on the bike. He didn't feel like he had enough pull, right? He wasn't able to use the back of his leg efficiently. He was having trouble controlling where his foot was, and how his knee was moving while he was pedaling. And he felt like it was becoming a little bit dangerous, and it would progressively get worse to the point where the burning sensation was more than he could ignore anymore about halfway through his runs. And that pain just got so unbearable that he eventually just gave up bike riding. But he thought that he'd just have to rest for a little bit. And so he rested for a week or two, tried to get back on his bike. That ride ended badly. And so he calls his primary care, gets in to see a primary care. They order x-rays, imaging, and send him to the orthopedic doctor. Thankfully, he wasn't too thrilled, but thankfully there wasn't really anything huge on his MRI that indicated like an immediate surgery or really anything. The doctor offered him cortisone shot, but was not optimistic, apparently. He was like, I can give this to you, but it may or may not make any difference in what you're dealing with. And so he didn't opt to take the cortisone shot because that wasn't much of a sales pitch. And so he did take the exercises and the stretches that the doctor suggested. And so he went home and he religiously did them. And much to his dismay, he was very upset by this. The stretches made it worse. So he was told to go home and stretch, and he did all the stretches. As far as he's concerned, he did them 100% correct because he's following exactly what's on this piece of paper. But his pain level was going up. So he calls the ortho. The ortho says, well, maybe go try therapy. So he's calling people down the list, and we end up chatting. Enter me, right? So he comes in, and we look at how he's moving and really what's going on with his sciatica. So let's talk about what sciatic is. Sciatica is the pinching of one of the big nerve that comes out of your spine and really deals with all the muscle strength and all the skin sensitivity, like the fact that you can feel your skin. That nerve controls all of that. So all the muscles in your leg, all the sensation. And so when it gets pinched, depending on how hard it's being pinched or how it's being annoyed, you lose either sensation or function, and you get this really strong burning sensation. And that pain can fluctuate. For most people, it fluctuates. Sometimes it stays in their butt, then they move a certain way, and they can go all the way down to your heel. And it's very shocking. It grabs your attention, and for most people, it's very hard to ignore because it's pretty much there all the time. And if you move a certain way and it doesn't like it, that discomfort lasts a long time. When you aggravate a nerve, it's not the same thing. Like if somebody accidentally hits your arm too hard, that discomfort goes away relatively quickly. Your muscles just sort of are very forgiving in that sense. You pinch a nerve, even if it's only for half a second, you'll have discomfort for at least 5 minutes. It's unbelievable what the difference is. So nerves do not like compression. So, and that was what Aaron was dealing with, is he was dealing with this nerve was just constantly irritated, and he didn't really see a rhyme or reason as to what was annoying it. But now it was annoying him because he couldn't bike ride. That meant he couldn't hang out with his friends. That meant he didn't get to clear his mind. It meant that he didn't have a reason to go have a beer at a bar, right? All these things that made life enjoyable to Aaron were all being taken away, all because of this nerve pain. And so when we evaluated and kind of saw where things were, I went over how to do the stretches so that they didn't annoy him, which was actually, and a lot of times sciatica, you don't even want to stretch. So we went over the things that we would want to do and why, to really explain the anatomy and what was going on specifically with him. Because everybody's sciatica can be caused from different things. It can be caused from a tight hip muscle, but it can also be caused from a spinal compression, something happening in your spine. And so it just sort of depends on what's happening with you and your particular situation. And some of that can have something to do with your job, how much you sit, how much you walk, what you lift, all these other variables that can be in play. How long you drive, and just so many things can play into what's going to help you specifically with your sciatic pain. And so we talked about position changes. We talked about, again, how you'd stretch, what things we strengthen, and we came up with a very global plan specifically for Aaron, with his goal of getting back to bike riding 20 miles to a bar, 20 miles back from a bar. And I'm very happy to say, and I'm sure Aaron is also, that he is fully back to that. And I believe I mentioned that I saw him, I met him many months ago. That does not mean that he had to see me consistently through there, right? There are milestones that people hit with rehab and getting better. And instead of taking a traditional approach with people where you have to do all these visits right here and right now, and you're going to get better in just 6 visits and life is going to be amazing, I tend to take a more holistic approach, and we look at specifically what you're trying to do, and we get you a good program, and then if we need to, we do follow-ups. And those follow-ups can look an infinite number of ways, right? So once you get rid of your pain and we're really on a good, strong strengthening program, that takes time. So, you know, we adjust how frequently we see people based on what their specific needs are and how much accountability that they need, because that is a varied amount for everybody. Some people don't need anybody to work out with them, and they will religiously do things every day. But some of us, we need a little bit more motivation. We need somebody that's going to be there and say, you know what, you really do have 10 extra in you. You can do this. And so I treat each client as they are an individual person with individual lifestyle choices and individual needs. And everybody's body is at least slightly different in how they're going to react to things. So I find that one size fits all programs work for very few people, because it's taking a big global look at what it would look like for a lot of people and trying to make sure the masses are happy. And that, especially for what I do and the specialized treatment that I give people, that does not work. So again, I take a very specialized and individualized plan for each person based on what their goals are. So here Aaron is back to riding his 20 miles, enjoying his day with his friends, and then riding back. And he's very excited. So if this is the type of care that you're looking for, then I have 2 options for you today that I will offer you. One is a discovery visit. That is a 20-minute session where you and I, and it's for free, sit down, talk, get to know each other, and see if I'm the right fit to help you get to your specific goals. In some instances, there's a movement assessment, and sometimes we don't need to get there, but we have 20 minutes to figure out if I'm going to be able to help you. Now, that's one option. So the other option is something called a full body diagnostic, and that is, again, 20 minutes. I charge $20 for that, but it is an actual movement assessment. I will not call it an evaluation, because evaluations has a lot more hands-on and some manual things that can go with that. An evaluation would also have treatment with it. But so this is just, let's see if there is a mechanical thing, if there's something that we can see that would warrant further looking into to help you get back to what it is that your goals are. And it also helps you screen out whether or not therapy is appropriate for you without having to commit to a full evaluation, because if we're not appropriate, we're not appropriate. So, and I would help you find the most appropriate person for you with either one of those choices that you pick, because I don't want to just send you into the mire that happens to be the medical world at this point to figure it out on your own. I would definitely help you figure out the next best step for you. So I hope that this information is very helpful, and I hope that you are not being impaired by sciatica and you can enjoy your bike ride this weekend. Have a good one.